Isa ka, dili siya mo ano, dili mo, be, sa walwalan din ako ni King Walwalan.
Uy, naoni mo.
Hello class, good morning. Good morning. Nakamute pa gyapon?
Okay, sir. Good morning, sir.
Good morning. So, class, we already discussed a lot of things in regards with the history of public health. So we already tackled prehistoric era down to shamans, then the different prehistoric health practices. We also tackled ancient Egyptian civilization down to the Greek civilization and to the Roman civilization. Then we have the medieval period. And we also talk about the Black Plague, no, or the bubonic plague, or also known as the Black Death, down to the world's first medical school, which is the Schola Medicana Salernitana. And we also tackle the health guide for the masses, which is the Regimen Sanitatis Salernitatum. Okay. So after this one, we have the Islamic civilization. Though gamay ra pud siya kaayo no sa Islamic civilization, and there were prominent individuals or scholars for this period who contributed a lot in the field of medicine and public health. Okay, maklaro na ang ang screen.
Yes, sir.
Ako di ko kaklaro. Ana. Sa net siguro ni. Okay, Islamic medicine developed from the influences of Greek and Roman traditions. Many of Greek and Roman writings and manuscripts were translated into Arabic and were preserved and kept safe from the destruction and oblivion in the process. We have three prominent individuals who contributed a lot in the field of medicine and public health during this period. Number one, we have Al-Razi, which is also known as Muhammad ibn Zakaria Razi, who is known as the father of pediatrics. He wrote the book Diseases of Children and was said to be the trailblazer in the field of ophthalmology. Okay, ophthalmology is one of the specialization in the field of medicine who in the field of medicine, usually ang iyang gina-istudyan is mga eye diseases no in terms of mga isa limat ko. Okay, mga diseases sa eyes no. So usually mga nerves, may mga cataract mo na sila sa mga ophthalmology na siya. So ang gastadya ni the one who specializes the eye diseases are the ophthalmologist no. They're ophthalmologist. And the second person or prominent individual in this period is also Avicenna. Okay, before going to Avicenna, Al-Razi is also a pharmacist who wrote about medicinal plants and other modes of therapy. We also have here Avicenna, is also known as Abu Ali al-Hussein ibn Abd Allah ibn Sina, who wrote the Canon of Medicine. It's a major reference book for medical schools worldwide. Okay, it arises until the middle of the 16th century. Okay. When you talk about century, guys, ano siya na century para sa inyo? Like for example, today is this year is 2024. So, unsa ta nga century karon? Normandy. Unsa ta nga century karon? How do you
21st, sir.
Okay, so the 21st century started when? Okay, it started when? January 1, 2000, no? Until December 31, 20, December 21, 2200. Tama ba? Ay, 21 ba? 2000 ba? 2000. 2100, okay? So, January 1, 2000 to December 31, 2099. I know, 2100, okay? Tama ba? Ay, isa. Marag nalibog ko, guys. Sorry, guys, ha? Okay, January 1, 2000 or 2000 to January 1, 2100. Okay? So that is the 21st century. So we belong to the 21st century people, no? Di ata na belong. Okay, let's proceed. Okay, one of the major contributions of Islam in medicine was the proliferation female doctors, since medieval Muslims would only want female physicians to examine female members of the household. You know what, guys? Until now, it's being practiced by the Muslims in the Middle East, no? So, ang ga-examine gyapon sa hospital sa mga babae, ang babae gyapon ng mga physicians. Okay, moving on, we have the Renaissance period. We have several individuals here. Some of them are doctors, some of them are scholars. Okay, we have Fracastoro. Girolamo Fracastoro. He broadened the public understanding of how epidemic or infections were spread. He also introduced the concept of fomite, which could be the vector, vector, or could be a vehicle carrying pathogens that could cause the diseases. We also have Andrea Vesalius, who wrote on the structure of the human body, where he described a detailed structure of the human body. So, meaning he really had contributed his work, sa field sa anatomy and physiology. We have William Harvey. He is an Englishman who did an intensive study of the human circulatory system and properties of the blood. Okay, William Harvey is also a scholar, a scientist who also contributed a lot in the field of human anatomy and physiology. Okay, if you're familiar with Anton van Leeuwenhoek, is very popular sa botany and even zoology. He observed bacteria through a crude microscope and other microorganisms, and therefore initiated a new thinking on diseases and how they can be caused by these organisms.
Excuse
In
me,
fifth,
sir. Magula, nag-load ang PowerPoint, sir.
hala, karon lang? Karon lang? Or nag-stop siya?
Okay na, sir.
Sa net siguro. Ma'am, hina yung net, ma'am? Off daw. Okay, moving on, guys. We have the 15th century. 15th century. Okay na, guys.
Yes, sir, sir.
Sorry, inapod na ako makita ng Anyway. Okay. During the 15th century, the Italian boards of health started institutionalizing a system that would record and register deaths, especially due to infectious diseases. So later on, they have this term called bills of mortality na ilang gibuhat, no? This refers to form of death registration. So many cities in Europe, specifically in London, had a very good documentation of these bills of mortality. We have a prominent individual here who is called John Grant, who made a pioneering analysis of the bills of mortality in his work called Natural and Political Observations Made Upon the Bills of Mortality, which became the basis for evidence-based planning and evaluation of public health interventions. During the same period, European countries started moving out of continent to conquer other lands and to find alternative routes by sea to reach trade centers in Asia. So in colonial period, guys, this is the period of discovery of new lands, cultures, and exchange of diseases between colonizer and the colonized. Like for example, Spanish colonizers brought with them the smallpox virus to the Americas, which decimated thousands of natives in the New World. And the New World also brought with them the new disease syphilis, which baffled European physicians. Okay? Kani mga syphilis, once this Spaniard colonizers mobalik or returned back to the land that they conquered, kakahawa po sila, murang matakdan po sila ani. Kaya naman, ang kaning New World po, nga ilang mga gina-colonize ng mga glands is also bringing some disease like syphilis to them. So murag vice versa lang, no? That's why once ang Spanish colonizers, no, makaadto sila sa one land from another land, they actually brought diseases. And then that's how diseases spread worldwide. Kay ga-colonize man sila, ga-discover sila ng mga lands. And at the same time, kato ilang gina-discover nga lands, there are actually people living in there. And these people have also diseases that are also contagious. So, nagpuli-puli ra. Kani, madala na po niya sa laing land, madala bisan asa. So, that's how diseases spread fastly or quickly. No? So the New World introduced new remedies to diseases in European societies, such as the discovery of quinine from a South American quina tree became the first medicine against malaria. Okay, quinine. Uh, any medications that belongs to the quinine family is an anti-malarial agent. We also have Carl Linnaeus here, no, a botanist called the tree cinchona in honor of the Spanish countess Chinchon, who brought the bark from the tree when she returned to Europe from Peru. So si Carl Linnaeus, siya nag-introduce sa cinchona. For a while, guys, ha? See that. Okay, sorry for the interruption, guys. Okay, again, Carl Linnaeus, a botanist called the tree cinchona in honor of the Spanish countess of Chinchon, who brought bark from the tree when she returned to Europe from Peru. Okay, cinchona is also used as anti-malarial agent. Okay. Moving on, Chinese use another type of plant to cure fever and malaria, and they call it King Hao plant. Okay, King Hao plant. Okay, the scientific name is Artemisia annua. Okay, I am familiar with this one. No, it is also it's also one of the anti-malarial agents that is very popular in black countries like Papua New Guinea, where I worked no before. So from this plant, the chemical artemisinin, no, kani gyud ang ginagamit mo po niya ang active ingredient niya artemisinin was isolated and still being used in combination with other drugs to treat the disease malaria. Okay? In 1800, we still have little understanding about malaria, which they also referred to as bad air. Okay, during this century or this period, we have a lot of prominent individuals also here, no, nga nag-contribute gapon sa public health in the field of medicine. We have Charles Louis Laveran, a French surgeon, discovered parasites in the blood of patients suffering from symptoms of malaria. That scientists started to comprehend the etiology of the disease. We also have here Ronald Ross, who discovered the malarial parasites could be transmitted by mosquitoes, and patients would get infected by the parasite through the bite of the mosquitoes. Okay, as year goes by, no, in 1800, the process of vaccination and or immunization is introduced. And it is the biggest innovation in the field of public health, which was pioneered by Dr. Edward Jenner. Dr. Edward Jenner is the father of immunology, who discovered the vaccine against small virus. He coined the term vaccine from the word vacca or cow. Okay. Actually, guys, si Dr. Edward Jenner, nana siya story, no, about the about immunization, okay, about the vaccine. So for a while siya. Okay, sorry for the interruption. Okay, actually, guys, there is a story about this vacca or vaccine. No, how did Edward Jenner came up with this one? Okay, he's the father of immunologists because he discovered vaccine against smallpox virus. Okay, before si Jenner Mangod, he observed this milkmaids pa, this women that is living in the or working in the farm. Okay? Nga duda siya nga nung dili sila gakatakdan aning smallpox virus. Okay? And then these women, these milkmaids are actually managing the farm. Usually the cattle, mga cows, basta cattle, no? And these cows, kaning mga cow, nanay sila ga-exist nga mga sakit. This is what we call cowpox ba? Cow cow na nawala na yun ko. Cowpox. Okay, that's cowpox. That's what we call cowpox. Okay. The causative agent for this one is cowpox virus. Okay. So ang he assumed, no? I mean to say he surmised or assumed that the exposure of these milkmaids or of these women working in the farm who is managing cattle are resistant to smallpox. Kay kaning mga baka na nabi sa mga smallpox ngano di man sila gakatakdan mo ni ang pagtuo ba. So meaning to say resistant sila sa cowpox, ma-resistant po sila sa smallpox. So to confirm his hypothesis, no, he injected this cowpox pustules. Guys, these pustules, no, these are actually blister, no, it's a boil or a blister, no, from which you can find a pus inside. So blister siya naa siya pus inside. So iyang gikuha tong pus, uyan ning gi-inject sa isa ka bata. Ang pangalan sa bata is okay, the name of the child was James Phillips. So, iyan yung gi-inject ang cowpox pustule kay James Phillips. It's an 8-year-old boy and he assumed that the boy should be resistant to smallpox afterwards. Kaya ang katong mga milkmaids na resistant man sila, no? Sa di pa sila kakatakda ng tong smallpox because of they are already resistant with the cowpox since they were working in the farm for the longest period of time with the cattle. So that's how he perceived this, the hypothesis, no, of his. So he presented his findings to his peers, which were initially received with doubts and even opposition. Jenner continued his experiments and was later able to convince many of them until he coined the term vaccine from the word vacca. So dito din nakuha ang baka nato no, V lang vacca. Kay gikan dadto dito diyan, I mean ang story dito no, nagikan gud kay vacca or cow. Now I know, no? And now you know also. Okay, along the colonial period, or yeah, colonial period, was the rise of a lot of industries, different kinds of industries, and this is what we call industrialization. So industrialization saw not only the development of highly urbanized centers, but also public health challenges. Okay, and one of those public health challenges during this time, guys, are public health. Public sanitation and overcrowding. So ang population, no? So overcrowding. There's an increased number of population in each community. Another prominent individual here is Edwick Chadwick. Who is Edwick Chadwick? He is the secretary of England's Poor Law Commission. Wrote a book entitled "Report on the Inquiry into Sanitary Conditions of the Laboring Population of Great Britain." And which is considered to be the most important document of modern public health. Why nahimo ni siyang importante nga document, guys, sa modern public health? Ang report on the inquiry into sanitary conditions of laboring population of Great Britain. Why? Because it led the way to reforms that benefited the working class, especially when it came to their health situation. Wrong grammar ni Dereo. When it comes to their health situation. Among the many challenges faced by England during this time was cholera outbreak. What is a cholera outbreak or cholera? It is an acute diarrheal illness caused by the infection of the intestine with Vibrio cholerae bacterium or Bacterium Vibrio cholerae. Okay? Okay, another person, important individual in this period who brought a lot contribution to the field of public health, especially in the field of epidemiology, is Dr. John Snow. No, he elucidated how cholera was transmitted by tracing the source, which was actually a water pump. So sa tubig siya, no? So ang tubig nagikan dito sa water pump. With this, he earned the distinction of being the father of epidemiology. So during this period, also various health-allied fields were established and professionalized. If you're familiar with Florence Nightingale, is very popular in the field of nursing. Is a woman, a lady who helped push the professionalization of nurses during this time. We also have here Lillian Wald, who introduced the concept of public health nursing while working with the poor in the United States of America. Okay, another prominent individual during this period is Robert Koch, or Koch. Okay, Robert Koch formulated the Koch postulates. Okay, developed the field of bacteriology. And this Koch postulates are as follow. Postulates means, guys, is a truth or it could be a fact, a statement that is being agreed by others, even if it's kanang incorrect ba. Maybe there are doubts, but it could be also correct. So that's postulates, no? That's how you... Sa nawala na ko, asa to. Okay. Okay, Koch postulate states that... Okay, Koch postulates or... Yeah, Koch postulates. Napa siya term, Koch postulates or... Anyway, Koch postulate states that the microorganism must be found in abundance in all organisms, from the disease from the disease but should not be found in health organisms. So pasabot niya, pag naisakit ang tao, na ay microorganisms dito, nagpuyo. Kung healthy ang tao, wala yung microorganisms. Tama ba, Mama Ivy? Mama Ivy nagkatawa, guys. Okay, number 2, the microorganism must be isolated from a diseased organism and grown in pure culture. The third postulate of Koch is the cultured microorganism should cause disease when introduced into a healthy organism. Okay, if a healthy organism encounter this cultured microorganism to them, so mag-create siya og disease sa ila. So ano yung pasabot. And number 4, the microorganism must be re-isolated from the inoculated disease experimental host and identified as being identical to the original causative agent. Okay, those are the 4 postulates or cause postulates formed or created by Robert Koch. Another scientist here, Louis Pasteur.
Wait, what's your...
Okay. Okay, it's Louis there. Louis, guys. No? Louis Pasteur na may nun. Louis Pasteur. Silent S, no? Louis Pasteur. Okay, Louis Pasteur. No? If you're familiar with pasteurization, sayahan yung gigikan. Louis Pasteur challenged the predominant concept of spontaneous regeneration. His work ranged from fermentation, we have inoculation of vaccine against rabies and killing of bacteria in milk, which is known as pasteurization. Okay, in the 20th century saw the rise of many developments in public health, most of which were associated with social reforms. No? The early part of the 19th century was still predominated by infectious diseases such as we have the polio and the yellow fever. So they started on the 19th century. Okay. So what is polio? How do you define polio? This is actually another disease now that is caused by poliomyelitis. Okay. This is a disease caused by poliomyelitis. It targets the nerves and the spinal cord, causing paralysis. Okay. We also have yellow fever, which is caused by arbovirus. Okay, and transmitted via mosquito by its bite, no? Pwede pod mga ticks. Ay, sa for a while, guys. Kapasi ko. Okay. Okay, sorry for again another interruption. Okay, we have the yellow fever. Who is also one of the infectious diseases dominated in the early part of 19th century. Okay, yellow fever is caused by arbovirus, transmitted via mosquito by its bites. No, mosquito or pwede gapan mga tick bites, and it's also transmitted to humans by its bite. Okay, in the Philippines, the American colonizer, after defeating the Emilio Aguinaldo-led revolution, established what we call the Board of Health for the Philippine Islands. Okay, Health Commission in the Philippines was called Board of Health for the Philippine Islands, which later on replaced by Bureau of Health and renamed as the Department of Public Health and Welfare. and eventually became DOH or Department of Health. And still, until up to this time, Department of Health kaya po ng tawag, no? So from Board of Health for the Philippine Islands to Bureau of Health to Department of Public Health and Welfare to DOH or Department of Health. And the first secretary of DPHW and also known as the father of public health is Dr. Jose Fabela. Because of his works guys, no, si Dr. Fabela sa DPHW or DOH or most specifically sa iyang journey sa public health, there is actually hospital in Santa Cruz, Manila that is a center of it's a child birthing place, no, it's not one but the first hospital in the Philippines nga iyang gina-specialize is ang pagpaanak, no? So dagan kay midwives ito, that's what we call the Dr. Jose Fabela Memorial Hospital, which is located in Santa Cruz, Manila. No, nakaadto na pod ko aning hospital, dako kay ni siyang hospital ang Dr. Fabela. Okay, and another prominent individual that contributed a lot also sa field sa medicine, not because he's a doctor. Well, guys. Okay, guys, moving on. But but you know what, guys? Public health was actually introduced before, no? Before Bacay Fabela, since the Spanish came. So the Spanish colonizer actually is the first one who introduced the public health to us, and it was just developed by Dr. Jose Fabela. Okay, but during this period also in sa Philippines, no, a prominent individual who is a father, a Franciscan priest who organized the first hospital in the Philippines. He is Father Juan Clemente. And the name of the first hospital in the Philippines is San Juan de Dios Hospital. Napakinggan siya San Juan de Dios Pueblos Hospital. But you can also call this one San Juan de Dios Hospital. Okay, it's actually located along Manila Bay sa Pasay City. No? Doon rin siya sa MOA. Okay, sa Mall of Asia. I went to this hospital also. Dili kay siya anak ko, but this is the oldest hospital in the Philippines. San Juan de Dios Hospital. And the priest who organizes this one was Father Juan Clemente. Okay? So, boom na ang public health. There were a lot of developments. And now we have the first medical school in the Philippines, and that's what we call University of Santo Tomas or Universidad de Santo Tomas. No, that was called before. Karon, University of Santo Tomas, the first medical school in the Philippines. The Spanish colonial government also organized this what we called Medicos Titulares. Medicos Titulares. Ang equivalent nga pangalan niya ani are provincial health or district doctors or provincial health workers. Okay? Medicos Titulares. In 1948, WHO or World Health Organization was established, and 2 years after, the Center for Disease and Prevention, CDC, no? Ang CDC until now naagya po na sila, no? Makita ni mo na lang mga stickers sa mga hospitals. Muna atong standard gina-follow karon sa tibuok hospital sa tanan kalibutan when it comes to pandemic nga mga guidelines and rules and regulations, no? This is actually under also sa WHO. Okay? So CDC was organized and created, founded by Mr. Joseph Walter Mountain. Okay? Other developments in medical technology include the discovery of penicillin. Who discovered penicillin, guys? Oh, he is Alexander Fleming, no? And the development of polio vaccine by Jonas Salk and Albert Sabin. In 1978, countries around the world gathered in Alma Ata. If you're familiar with that one, Alma Ata, no, conference, Alma Ata in Russia, di ba? Russia, and came out with the pioneering document called the Declaration of Alma Ata on Primary Healthcare, which defined primary healthcare with its goal HFA by the year 2000. So what do you mean by HFA? Health for all by the year 2000. Ako'y kapangutan, ako'y gato ba guys, no? Pero okay na siya. Primary healthcare is defined as essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at the cost that the community and the country can afford to maintain at every stage of their development in the spirit of health reliance and self-determination. This is the accurate definition of primary healthcare sa Alma Ata conference. Okay? It's actually sponsored by WHO, UNICEF in 1978. Okay? Always remember, guys, this their goal was actually health for all by the year 2000, which was a long-term argument, a long-time argument within medical professionals on how they can achieve this goal, since they don't have this step. Wala sila step on saan nila pag-achieve ani nga goal. Dili kay siya specific, it's broad. That's why gadoubt ang uban ani, no? Especially the people involved sa conference. A year after this declaration, the Health and Population Development Conference was held in Italy, and that was called Selective Primary Healthcare. Was introduced no, after that. Okay, that's supposed to be a 1979, no? So, selective primary healthcare ang na-introduce during this time, no? 1979. And in 1982, let's see, the UNICEF, or the United Nations International Children's Emergency Fund, came up, or it was introduced in 1982 with what is known as GOBI strategy. So GOBI, what do you mean by GOBI? The GOBI. GOBI stands for growth, monitoring, oral rehydration therapy, breastfeeding, and immunization. And later on, they added triple F, the FFF, to the GOBI. So name mo siyang GOBI FFF, no? Which stands for the first F, family planning, second, food supplementation, and the third F is female literacy. So it becomes growth, monitoring, oral rehydration therapy, breastfeeding, and immunization, family planning, food supplementation, and female literacy. So that's GOBI FFF. Okay. In the latter years of the 20th century, which is 1990 plus mga 1987 or 1990s, dito ni arise ang sakit nga AIDS, no? And that is what we call acquired immune deficiency syndromes, or AIDS. It is caused by human immunodeficiency virus, or HIV, which doesn't have any cure until now. Wala siya cure, no? No current cure until now. So how AIDS is being transmitted? It's transmitted via unprotected sex. So it could be transmitted also by contaminated blood transfusions, no? During blood transfusion sa hospital. Then we also have mother to child during pregnancy, no? So ito siya mga mode of transmission niya, no? In 2003, or the first years of 2003, the world actually hit by by its first pandemic, and that's what we call severe acute respiratory syndrome. Okay, just put SEVERE, no, long run spelling. Just put E after R. Okay, or SARS. It's a viral respiratory disease of zoonotic origin caused by SARS-CoV coronavirus. No, that's one what we call coronavirus 1 or type 1. So again, SARS-CoV-1. The number one here is the subtype number 1. And the first pandemic that hit the world in 2003. Okay, again, this disease doesn't have any cure. No current cure. Okay? Another disease that hit the world, no? In the latter years of 19th century is the swine flu, or it is also called as H1N1 flu. Okay. Unsa may pasabotan ng H1N1, guys? Even me before, I do not know this one since until nag-research ko ano. So H1N1. So H and N are actually a type of proteins, no? And that number one after H and N are actually the subtype. The subtype are actually numbers 1 to 18, and this H stands for hemagglutinin, no? Hemagglutinin subtype 1, and N stands for neuraminidase, no? Neuraminidase, tama ba? Neuraminidase, tama to. Neuraminidase, ako isulat na lang. Hemagglutinin. Okay, hemagglutinin subtype 1 and neuraminidase subtype 1. Okay, swine flu is a form of influenza which affects the pigs, no? Usually the hogs or pigs, caused by influenza A virus in 1998, and new strains of virus emerged as H3N2 and H1N subtype 2, no? Strains of virus. Okay, another disease in the latter years of 20th century is the avian flu, or which is also called bird flu. It's a disease caused by infection with avian bird influenza A virus in 1997. The strain of this virus is also called H5N1, which hit the poultry, mga manok, no? Basta bird, usually poultry, no? Poultry yun siya. Okay. Okay, moving on, we have the Ebola virus disease. Okay, which is also known as Ebola, EVD or Ebola, which stands for Ebola virus disease or Ebola hemorrhagic fever. It is a deadly disease caused by infection with one of the Ebola virus strains, most specifically family Filaridae and genus Ebola virus. Can be transmitted to humans and non-human primates such as monkeys, chimpanzees, basta mga unggoy, guys, no? Unggoy, monkeys, chimpanzees, gorilla. People ang gorilla ali, no, sa Ebola virus. That's it. Okay, these are just very important events, no? It happened during their respective periods, no? So take notes of the diseases, the causative agents, and the prominent people and individuals who contributed a lot, not only in the field of medicine but especially in the field of public health. Okay, so next meeting we'll be talking about the community health, epidemiology, and human behavior. So let's meet online next meeting. Okay, so next week will be our exam, our midterm exam, and we have two coverage for the exam, chapter 2 and 3. So please have an advanced study of reading on community health, epidemiology, and human behavior topics. I'll be posting this topic on Wednesday. So as soon as I post the topic, you guys can actually read it. No? Taas-taas sa gamay, guys. Pero please read them all, no? But most of the coverage or the questions will be taken from chapter 2. Okay? So, thank you for any questions? Monsanto, Axel,
None, sir.
nara mo sa balay o dire?
Balay ko, sir.
Okay, see you. Okay, guys, thank you so much for your time. Thank you for joining the class and have a good and a blessed Monday to all. Okay, see you later sa cosmetic na nga class. Now we will have a laboratory.
1 p.m., sir ba?
Can you just come at 1:30 kaya amo pang tarong ni napami i-asikaw so ni Sir Nico regarding sa mga ingredients to. So
Thank you,
please bring ka ng container lang. Sa nga container, ma'am, butang lang ninyo tong DFP. We'll be tackling about the DFP, the deodorant food powder. Okay? So, dali ra kayo siya guys, mga 30 minutes humanatay. Isagol ra man na tanan. No? Basta lang, ang procedure ninyo, tama yung pagbutang paghimo sa procedure, no? Pag-follow. O, lab 1. Klase. 2:30? Sana lang. Guot kayang farm lab 2, ma'am. Sa 50 ka bo. Oo, sa physics na lang. Farm lab. Guys, kung wala gani physics, kung naaga ni ang, wala gani ang physics, naaga ni mga metric to, ato na lang sa, okay. Okay na si ma'am? Wala? Uy, tarong ba?
Pero sa farm lab 1, sige na, to 30
Abot. Okay, thank you ma'am. Okay guys, okay. Sa farm lab 1 ta ha, 1:30 p.m. Okay, thank you for joining the class. Thank you so much. Bye.
Thank you, sir. Goodbye.
Chem na lang ka.
Uy, tara na.
Bye, sir.